I would request each of our guests to please open the book. And guess what the book is called? I mean, this could be a tagline for GC himself. It says, "The human touch in modern medicine." And I think there's no greater example than GC himself, who actually personifies this, GC who practices this, and GC who advocates that we need in this era of technology where compassion is often lost or overlooked, where we tend to look at the end, the treatment, rather than the process of that treatment. We are more satisfied at having discharged the patient in health rather than consoled the patient during his illness. That is what this book actually is all about. It's actually about what makes Dr. Gourdas Choudhuri special. Reading this, as I've had the pleasure of reading it before it was launched, told me of many things that I knew but didn't practice, which I would now, having read and get some insight into it. I'd request Dr. Ashok Seth to say a few words about human touch in modern medicine, because the only way the human touch was in cardiology was to take the pulse, the blood pressure, and put a stethoscope on the chest, which I think is a lost art, but as Dr. Seth will tell you, is what pacifies, satisfies, and begins the treatment when a doctor touches the patient. Over to you, Dr.
Thank you very much, Dr. Tyagi, and dear friends. It's indeed an honor and a pleasure to be here amongst you all, an august gathering of gastroenterologists, hepatologists. But I must also tell you that I don't feel out of place. I don't feel out of place because I'm here with one of the greatest friends, a person who I admire most, and a person who I'd just say, if he wished it, I was going to be here. But you must be wondering, why am I a guest of honor? Now let me just tell you why am I here. It amuses me. It was just a few days ago. I just returned from the United States. It was, I think, Tuesday. I was jet lagged. It was Wednesday morning. I received a call from Dr. Choudhuri, Gourdas, my dear friend. And he says, listen, I've got a book, and I'd like you to be the guest honor on that launch of that book. It's to do with compassion. It's got to do with the human touch in medicine. And I said, guest of honor? And I knew he'd got the wrong person, by the way. And I said, he's probably got the wrong person. He's got the wrong number. And therefore, I said, maybe I should just say, I'm Ashok Seth. Gourdas, you must be looking for another guest of honor, not me. And then he says, then I said, why am I going to remind him of that? This could be my chance to rise to fame. You know, being amongst great persons like him, among great hepatologists like here, he said, ye to batana hi nahi hai usko main kaun hu, kisko phone kar diya. And I said, I've accepted it, Gourdas. And he said, who are you? And I said, Ashok Seth. Oh, he said, oh, sorry. But I said, no, that's okay, Gourdas, now you can't go back on your word. So here I am. I said, my rise to fame. And then today, I knew last night, I've been jet lagged. I said, I've got to read about this. I've got to be thorough with this book, at least understand what is in it, because I'll have to quote a few phrases from this book. And so I had bad sleep, I was jet lagged, late heavy work, working till 10, doing cases till 11:30. And then I took a Zolfresh at 12 o'clock last night to think that I would get up at 6 o'clock in the morning and go through this book. Well, I picked up the book at 12:30 with 10 milligrams of Zolfresh into me and 0.25 milligram of alprazolam into me. At 12:30, I started reading this book. I beat Zolfresh, I beat alprazolam. At 4 o'clock, at 4:30, I'd finished the book. Gourdas, that is the credibility of every word that you've written. And if you feel I'm sounding sleepish and incoherent, then it's blame him for it, because I did not sleep last night reading this book. It is so important for us. It's so important. If I was to say about Gourdas, how do I know him so well, and a man of multiple talents that I envy him multiple times in a year, it's also with a privilege and honor that I had the Fortis Medical Council, which consists of some of the best minds of Fortis Healthcare, of which obviously he's one of the best minds of Fortis Healthcare. And when at that meeting, which goes on a whole day, we have numerous discussions on the SOPs which would influence patient management, outcomes, patient satisfaction, and in whole, elevate the standards of our medical care. We can go on a topic and discuss it amongst us for literally 20 minutes, through which Dr. Choudhuri would remain silent. And often I turn at the end towards him and say, Gourdas, what is your view on this? He has 2 minutes, he takes only 2 minutes, and he has 10 sentences. And that's why I admire him the most. The first sentence is always going to be what he's been musing over while 20 of us had been discussing for the last 20 minutes. The next sentence would go into a wit, a humor, which relaxes everyone. The third and fourth sentence is totally tangential to anything which has been discussed in the last 20 minutes. The third and fourth and fifth sentences sometimes make everyone wonder, were they really discussing the right thing, or was he really listening to all that discussion? Having finished that tangential angle to it, he then summarizes everything into what seems to be the most comprehensive and logical solution, which still hadn't been discussed in the last 20 minutes. And finally, he concludes, and as the 2 minutes, he concludes almost like saying, I rest my case. And when he says, I rest my case, sometimes I think, as the chair, I think I've got to go back again to these 20 minutes and rediscuss this all, because we have a new idea and a new solution to everything with Gourdas. And so I'm always flustered by one fact. Should he have the first voice, in which case it would make it much easier for us to have these discussions, and maybe shorter discussions, or should he have the last voice? In which case we need to keep going back to whatever we've discussed. But this book, by the way, is his first voice as well as the last voice. As I went through it today, or last night, as I would say, for the 4 hours, I took out the 5 C's that we must remember, which is ingrained in this book. And as we go through the chapters, they're fascinating. But if I had to say and summarize what he conveyed, it was these 5 C's. He conveyed the C of commitment. We have a commitment to our profession, we have a commitment to our patient. The second thing is, of course, care, the empathy. He has listed it out beautifully. It is the empathetic care which makes a difference to our patients, and we can't just not emphasize that fact again and again in our lives. We have to have compassion. That is very clear. Beyond compassion, our patients won't get better. लोग कहते हैं ना कि आपसे मिल गए तो आधा मैं ठीक हो गया. That is still true till this date, even though science is changing around us. We have to have competence. We are growing. Science is evolving. Expertise changes every day, and new technologies and new techniques coming, new knowledge is coming. And it is our important responsibility to continue to upgrade ourselves exactly like this. And of course, in technologies and skills, every day we should be getting better and better because we have to deliver competence to our patient. And finally, the fifth C is conscience. Dr. Gourdas Choudhuri has emphasized on conscience, on ethics, on the balances which we're going to face with morality, ethics, and law. And the conscience is what keeps you actually on the right path so that you deliver the right treatment to the patient. I would tell you that this book is not just a possession. We need to possess it, not for ourselves. We need to read it because it not just adorns our shelves, it adorns our heart, it adorns our soul, it will adorn our mind. And more importantly, it will make us a better doctor and a better human being. And I want to emphasize this. I'm not just talking out of my hat. I actually have a belief that everything which he talked about in terms of communication, in terms of medical etiquettes, in terms of appropriate behavior, in terms of appropriate dressing, when you meet a patient, in terms of patient privacy, oft forgotten, when we have hordes of patients and relatives while we examining another patient in our room. We've forgotten privacy completely. This is the confidence building that he has emphasized that we need for our patients. Many of us who trained in England, you remember those days? I still remember my days. 40 years ago, I walk into, as an SHO into a ward, and I'm looking at the numbers, of bed numbers, and I don't find any numbers, and I'm going to present all those patients, 40 patients, to the consultant as he walks in. It was 45 years ago. And I said, where are the bed numbers? And he said, what are you talking about bed numbers? You're supposed to know the patient. There are no bed numbers. You're supposed to know all these patients by name. And it took me a whole hour, let alone everything else, to start remembering every patient by name because there are no beds. And what are we doing ourselves? He's emphasized that in his book, saying, bed number 30 has got jaundice, and bed number 40 has just had angina. The bed didn't have angina. What was the patient's name is what we forget. So the art of, he's emphasized on the art of listening, dealing with angry patients, conveying bad news. The morality and ethical dilemmas, must read it. It is what we have to face, but we also have to learn, but not just what we have to learn, what we have to transfer to each of the people, each of the doctors who we train for. We've been training doctors all the time. I think we're forgetting some aspects of what we need to train them. We keep on training them on science, on technologies, on techniques, on being the most scientific and the most knowledgeable doctor. I don't think we're training them to be the best and the good doctor. The doctor's issues are also spelled out, and I must say the burnout has been an important aspect that we spelled out in the book. Please read it. He's looked at health hazard, he's looked at professional hazards. And I think, for your sake, I'm going to cover just a few excerpts from this book. In what he talked about EQ, which he says is emotional quotient, patients come to you not just for your medical expertise, but also for emotional support. Even if they don't express it outright, it is best to start developing a healthy emotional quotient. How important? We would think it's all obvious, isn't it? But how many of us not just practice it, but how many of us are transferring it on to all the trainees and all the junior doctors who actually walk around with us in our corridors? They never learned it in their medical school. Isn't it our responsibility that they learn it with us? I think it's so important. Watch this. He talks about communication and social skills of doctors. True wisdom goes beyond mastering medical knowledge. Beyond mastering medical knowledge, it's about personally understanding and connecting with the person in front of you. आधे तो डॉक्टर साहब आपको मिलके ही हम ठीक हो गए. We hear it less and less, don't we? Because we also have less and less time to hear these words. We have some beautiful excerpts coming out. And this is about communication and social skills of doctors. I have marked these so that you are able to take out more excerpts from this. It's an end-of-life care, a topic which is so discussed but often avoided. And we live in the midst of confusion, chaos, morality, ethics, and law. End-of-life care is not merely a medical protocol. It's about providing dignity and comfort to a dying patient. And what about patient privacy and dignity? Simple rule in life: if you won't like it done to you, don't do it to others. It is echoed in many ways across time, places, and cultures. Do unto others what you would have done them to do unto you. Medical science, even at this time, where we actually excel and believe that we're excelling to its peak, is totally of grays, very few black and whites. Science is only scraping a fraction of this human body which nobody's been able to create or understand. And finally, he says, strangely, communication skills and empathy, the two essential qualities of a doctor, needs most in the world, are conspicuously absent from the medical curriculum. And if they're absent from the medical curriculum, then they can't be absent from us as medical leaders, from us as medical teachers, because our students who tread every ward every day have to learn it from us. And it's our responsibility, isn't it? So I believe this book is firstly for all of us to read, imbibe, and deliver. And that's how we're going to transform others. It's for everyone. It's not just for healthcare workers. It's not for just clinicians. It's actually for even policy makers. It's even for hospital administrators. Patient connect, patient empathy. The 5 C's are the basis of our lives. Think of a single point. And Gourdas, I'm sorry, you said a few words, and I may be writing another book chapter out here. But if you just excuse me for 5 more minutes.
Yes, sir, please. I'll help you write the next one when you plan to touch on a somewhat of an altruistic topic like this.
And I'm going to tell you 2 other things which will interest you and which will be very fascinating. And will make you think even further. And those will be probably the next 2 chapters in Gourdas' book. You know, we are privileged. We are privileged to be in a profession where we are blessed numerous times a day, innumerable times a day. How? By just doing our daily job. There is no other profession where you're so fortunate, where we're so fortunate. But what's happened? Science and technology grew the fastest and the most in the last century. From the time when the Wright brothers at Kitty Hawk, that plane flew in 1903 for 120 feet. To man landing on the moon in 1969 was just 65 years. From the first computer which ever got created in 1943 to a first PC in 1973, we now have in our hands a whole computer. From the time the World Wide Web came in 1993, now we've got the world in our hand. And the medical science you've seen grow in yourself. What we did 15 years ago is today outdated. And 30 years ago seems almost unethical what we were practicing. So when we actually see the science, when I do a TAVI, which means transcatheter, non-surgical aortic valve replacement, on a patient who's dying and comes into the hospital, and he walks in and he's He's 35 and his relatives say he's dying. He's got severe aortic stenosis. And I say, I'll do it. I'll just take him to the cath lab on a ventilator. I replace his valve non-surgically. I come out, I say, it's done. He's alive. And what do I feel? They thank me, they fall on the feet, and I feel what? I feel like a human god. Science and technology has made us feel like human gods, that we give life to our patients. You know, somebody just said, he's the celebrity doctor. Isn't that the worst term for a doctor? There is no celebrity doctor. There is no human god. It takes a split second for Dr. Ashok Seth to walk down these steps, fall, hit his head, have a bleed in the brain, and the greatness of that celebrity doctor is gone in a second. It just takes a hand that I came out of that, replacing that TAVI, replacing a valve in the most fascinating manner that the world has not seen, non-surgically, and the tech bangs my hand in that door, and I can never be able to do a second procedure again. So the greatness is not there. So Gourdas, your next chapter in the book is, there are no celebrity doctors. There are no iconic doctors. And you have to define a chapter. What are these iconic doctors? What are these celebrity doctors? Don't they have to change their attitudes to say, I'm only a good doctor, and my greatness can go in a split second. A split second. So if you are thinking yourself to be so great, then how come it could be taken away in a split second? If it was your greatness, then it could not be taken in a split second. If you were responsible for it, who could take it away from you? And that brings me to the second point. Who could take it away from you? Who could take it away from you? We do the same procedure day after day. And the patient lives and we come out like human heroes. And we do the same procedure and a patient dies in our hands. And we say, what went wrong? Why did this patient not respond the way I wanted him to respond? It is just unthinkable that we do not understand the human body and we pride ourselves on analyzing and saying, हमने तो इसको जिंदा कर दिया, हमने तो इसकी जान बचा दी, हमने तो इसको ये दे दिया. So I'm telling you one thing. We've forgotten spirituality. We've forgotten spirituality completely in the miracles of science of 20th century. It was 20th century where you saw maximum science which had never been done. I mean, आप खुद ही सोच लो कि insulin बनी, before that people were dying from diabetes. 1923, people started surviving. We started giving lives. 5-drug regime for tuberculosis. 1953, sanatorium से लोग जिंदा होने लगे. Acute MIs, treatment. 4 weeks in bed, transformed into angioplasty out in 2 days' time. Mortality from 50% down to 5%. We saw things which we had never seen before. So what did it do to us? We forgot spirituality completely. And what happens? We forgot spirituality to the extent that we got enamored with science. Come 2000, the end of century, COVID comes in, a minuscule virus. It's gone. The whole humanity stops. The humankind stops. The streets across the world are empty. A microscopic virus destroys humankind to the extent to say, each one of us across the humankind said, God, please save me. मैं नहीं मरना चाहता. Remember that? भगवान मुझे बचाओ. मैं नहीं मरना चाहता. So if I was going to tell you and transform you to next thought process is that science and spirituality for us, even as doctors, who believe that they are transforming science to give lives to the patient, has to change. Science made us live on earth. It made us live in a better manner on earth. As we go into the 21st century, we as doctors have to imbibe spirituality as well. Patients get better because he believes that through our hands they're going to get better. And therefore, science and spirituality have to coexist if we've got to live in this world. Science made us live on earth. Science and spirituality makes us live in the world as doctors who have to function together. And therefore, Gourdas, I'll urge you, another chapter on how medical science, medical doctors have to combine spirituality to actually deliver to the best to the patients. With these words, I think I've taken more time than necessary of yours. It's been indeed my honor and pleasure to say a few words, just 10, 20, or maybe 1,000. But I think it's been wonderful. Read it. I know that I'm going to have a good sleep tonight because I kept awake. This broke the barriers of Zolfresh and Alprozan together. Two drugs which together should never be taken. But I was getting over a jet lag. After this, I don't have jet lags anymore. Thank you very much.
Thank you, Dr. Seth. Thank you very much. Before we bring this book launch to an end, I'll read out 2 lines which will actually tell you the inside thought of Dr. Choudhuri. The practice, especially in a conference where we've discussed so much of data, we've discussed so much of knowledge. The practice of medicine intertwined as it is with human life and emotions is far from simple application of knowledge and guidelines. It presents complex problems that frequently cause me to reflect deeply, constantly questioning what would have been the right course of action. Over time, I have come to understand that there are various perspectives and approaches to clinical situations, each with its own merit, none perfect in isolation. There is rarely a single, true, perfect solution. Thank you, GC.